Okay, let's say you have a normal spirometry. Does that exclude the diagnosis of asthma? No, because as you know, one of the hallmarks of asthma is that it's variability. Sometimes asthma patients present without any kind of symptoms, and sometimes you have a lot of symptoms. So how do you decide what to do and make that whether to make that diagnosis of asthma or not? In this case, you can add in a couple of additional tests. Consider this bronchoconstriction. It's a bronchial challenge test. It's called a methacholine challenge test. In this case, you're administering increasing doses of methylcholine and then measuring FEV1. And if their FEV1 drops by at least 20%, that demonstrates hyperreactivity and supports the diagnosis of asthma. Similarly, you could also opt to measure the fractional excretion of nitric oxide in the patient's breath. And so basically, the higher the concentration of nitric oxide, the more likely it is that they may have eosinophilic asthma. So once again, that demonstrates that the patient may have asthma as well. So just because you have a normal spirometry, be cautious. Remember, one of the hallmarks of asthma being its variability. You want to think about additional testing to be able to diagnose whether they really truly have asthma or not.